Hi, I'm Dr. Johnny. Today I'm going to show you a video of PDO threads used in the lip region to do one of several things, but a lot of times we're creating a beautiful edge of the lip with PDO resorbable threads. Why would we even put threads in and around the lip? What's it going to look like? And I'll show you a great before and after just after the video of placing the threads. So join me today. Okay, so PDO threads, a lot of people use them. There's smooth threads, there's coil or twist threads, and then there's barbed and molded threads, which we use to lift facial tissue and reposition, as well as building collagen. But they're also used in the lip. Now, if you like these videos, subscribe to them, and also don't forget to click the bell and you'll be notified for upcoming videos. And there's a whole playlist on my YouTube channel that's going to show you all kinds of videos on everything, including PDO threads. Let's get to PDO threads in the lip. The first question people are going to ask is, why would I put PDO threads in the lip? We use neuromodulators such as Botox, we use fillers. Part of the problem with fillers is, one, they can migrate. Two is people go in and they get filler after filler, and the filler doesn't do justice to the border. What did in terms of fillers? Collagen, derm or cosmoplast and cosmoderm that we had in the past. We stopped using them around 2004 because Restylane came in 2003 and they went by the wayside. But they were great because they didn't draw water in. That's the key to PDO threads, and that's one of the main reasons that I would put them in the lip border, which we're going to watch today. The other thing that we use PDO is for vertical lip lines. A lot of people don't want to increase the distance of the ergotrid or the distance from the nose to the lip, because as we age, that happens because the piriform aperture in the bone widens and the dentition changes. Not only do you lose facial bone, but the dentition changes and the bone that holds the teeth, and they get that untoward look. So if you are young and you have a short distance from the top of the lip to the nose, you know it's going to get longer and you kind of grow into it if you're looking for longer. But a lot of people get too long. If you add too much filler there for vertical lip lines, you can not only can it migrate because the mouth moves, but also it can give the look of more distance in that area. So let's look at a picture here. Here's a front-on view of a lip filler. Looks good. There's good volume. It looks appropriate for the face. But as we look to the side view, what we're going to see is a little too much projection maybe, or if anything, we know we can't increase the forward projection because we're going to look too ducky. And that's a fear of a lot of people, is that duck lip. So that's one of the times where PDO threads would be amazing. If this patient came back, was happy with the volume of the lip, but wanted a lip flip, wanted a little more upturn, but not a ducky lip, any little bit of migration of that filler, and it's going to look awkward and unusual. That's how we scare people away that really want lip filler but won't get it. Let's not scare our clients away. And a lot of people think if they get their lips done, they're going to look crazy. And it's because using too much hyaluronic acid, or over time, that's the look you get. If we take another patient and we have a look here, we see a longer ergotrid that we want to reduce. A little bit of lip volume would look great. But now if we look on the side profile, we get a different picture. Maybe not enough chin projection, but also we could use a little more flip to the lip. But we don't want it to try and look like a 20-year-old. We want a nice, crisp, vermilion border, but we don't want it looking unusual. And so PDO thread would be amazing in this case as well. Now, let's go to the video and watch them being placed. So if you look here, as you know, I put threads above the brow regularly for almost all of my patients. So this patient's had that. But she wanted a little more vermilion border, likes the volume in her lip, so wants to have a little crisper border. So we used a coil PDO thread. Why a coil? Because we wanted a little more PDO, polydioxanone material in there. And she's young, she can take a nice flip or projection of that lip, but we didn't want to change the ergotrid or the area from the nose to the lip. It was perfect for her chin projection. Now we're removing the PDO threads above the brow. Occasionally you get a little bruising up here, but you see in this case no blood at all. Here again, she's had the brow done, but we want to add to the lip. Now be careful not to overshoot. You don't want your thread to go past the philtral column, or you can see it when they move. Because the mouth is so dynamic, you have to be very careful here. There's a potential space of the vermilion. Vermilion means red, meaning the white, the red of the lip, and then you have the white. And right between the red and the white is where we're placing this. That's your vermilion border, or border from the red to the white. And then we remove it. You can already see a flip to the lip. We added a bit of volume, of course, with that thread, and it's very well tolerated. Now, if we go ahead and we look at the patient here before we place the thread, you can get a good look at that lip, a good look at the shape, and then we have a quick look after the thread. You can see the little red dot of blood, and you see it's just flipped up a little. Just a pretty look. Some might say a designer look, but if we use filler, it might look fake. And here you see the before and the after above to the right. Just a nicer shape to the lip that the patient wanted and enjoys. So that's PDO threads for the lip. They can be used in this case for a little designer look. They can be used in a more mature patient for vertical lines. They can be used with filler as an adjunct, but remember, they don't draw water in, so it maintains a crisp vermilion border, and a crisp border is a beauty border. And if you get away from that and it's blunted, that's a filler border, and we scare people away with that. Do you use PDO in the lip? Let us know. Join us on Instagram. Keep your skin and body beautiful, healthy, and vibrant.